So the first thing we do when we come in is we always wash our hands and we introduce ourselves. Hi, my name is Julie and I'm going to be your UNF student nurse today.
Great.
Can you tell me your name, please?
My name is Brittany.
Brittany, and can you tell me your date of birth?
7/12/1990.
Okay, awesome. So now I've got two identifiers. So I'm going to go ahead and test your orientation just real quick. So Brittany, can you tell me what brings you here today?
I'm just here for a general wellness check.
Okay, and do you know where we are?
We're at the UNF School of Nursing.
Okay, great. And do you know what year it is?
2021.
Okay, 2021.
Had to think
Doing
about
good. So we've got person, we've got place, we've got time, and then we've got the situation because she knows she's here for a wellness check. So there's your A&O times 4. Right, you guys?
Question.
All right, so now we're going to go ahead and start with our exam. We're going to skip past our review of systems because this is really about the exam today. So the first thing I'm going to do is just look at Brittany. So I can see that she's sitting up nice. She has good posture, good gait. She has a good affect. She's not crying. She's not stunted. She looks great. I would have watched her walk in the room too to see if I saw any gait issues. Then I'm looking at her and I'm seeing that she's symmetric. I see her face is symmetric. We don't have one side hanging down. And we see that she moves easily. So she's doing absolutely wonderful. So I look at her skin as I do every single assessment, right? So I'm looking at her skin and all the skin that I see here is fabulous. So we're going to start with a cranial nerve assessment, which is cranial nerves 2 through 12. Because remember, 1 is what? What is cranial nerve 1?
Olfactory.
Olfactory. And so we don't carry smelling lavender and things around with us, right? So we always usually say cranial nerves 2 through 12 grossly intact. So how to do those? Of course, we can start with EOMs. And so I say, Brittany, and we want to hold this about 6 to 12 inches from her nose. And we have her follow our finger slowly. This box is only 1 foot, so it's 6 inches to each side. So please follow my finger. And you pause. And this is testing cranial nerves 3, 4, and 6. It's really mean to go fast and to go far. And now this is convergence of the eye muscles, okay? Here's convergence. So next we can move on, and I lump all of my things together. So while I'm on her eyes, I'm going to go ahead and do PERLA, pupils equal and reactive to light and accommodation. So we go ahead and we start here, and we don't ever want to hit somebody in the face. We put our hand between her, on her nasal bridge to improve how much light. So if I go like this without putting my hand on her nasal bridge, it can make this eye constrict. Do you guys see that? So this just improves how well we're testing. So with Pearl, I'm going to look. So now I see direct. I saw her constrict. Then I'm going to do it in the same eye, but look at the other eye. In consensual, I saw this eye do what that eye did. So we're going to do it again. We're going to do direct, and then we're going to do consensual. So that's good. So now, Brittany, if you could, we're going to test facial, trigeminal nerves. So I want you to go ahead and raise your eyebrows. Can you puff out your cheeks? Can you clench your jaw? Very good, Brittany. Can you say light, tight, and dynamite?
Light, tight, dynamite.
Okay, and can you take your mask off? And I would like for you to open your mouth and say ah. And now stick your tongue out and move your tongue around. Okay, very good. And now lastly, to get all of Brittany's cranial nerves, I'll have her shrug her shoulders on resistance. So that is cranial nerves 2 through 12 are grossly intact. Now the reason I say grossly intact, some are sensory, some are motor, some are both. And if you noticed, I did mostly motor, right? I didn't do both. So that's why we say grossly intact. So now we've got that for her. We've already done her head. We want to move on to her lymph nodes. So we're going to do preauricular. So obviously in front of the auricle, right? In front of the ear, preauricular, posterior auricular, occipital on the occipital bone, submandibular, submental, anterior cervical. Now the sternocleidomastoid, you know, is that big muscle. So anterior sternocleidomastoid, you go down, and then you go posterior sternocleidomastoid. Then you do the same thing over here, anterior and posterior. Okay, very good. Now, I would look in her mouth. Let me finish that out. I want to look at her mouth. I saw her say, ah, and watched her uvula rise as part of my cranial nerve assessment, but I also have to check her tonsils, check her teeth, see if there are any lesions, see if there are herpetic lesions, HPV lesions, any of that. So, Brittany, can you take your mask down?
My tonsils are really close.
Okay, and you can say, ah. And she definitely has a grade 2 to grade 3 borderline tonsils. Remember, grade 4 are touching. Grade 3 have a little distance. Surgically absent is grade 0, where you can see nothing. Grade 1 is just a little. And so between 2 and 3 is where we really want it. More closer to 2 than to 3. But Brittany's got closer, a little bit closer to 3. Okay, so that's the head. Oh, no, I didn't do hearing. Keep recording. I forgot one. I forgot cranial nerve 8. So you can do cranial nerve 8 3 different ways. I prefer the whisper test. So to do the whisper test, you stand one arm length behind the patient so they can't see your mouth. You have them occlude the ear you are not testing. And you say 3 two-syllable unrelated words. So Brittany, I'm going to repeat 3 words, and I would like for you to tell me these words.
Christopher, Christopher, Christopher.
Oh! I was waiting for you to hear it. Oh no. Okay, so that can happen. So I'm gonna say a word and then I want you to say the word. Okay?
Beetlejuice.
I was like,
over here, like
she's deaf, so let's go ahead and call the interpreter. Okay. So I'm gonna say 3 words and you can just repeat them after me.
Yeah.
Okay.
Christopher. Tennis. Backpack.
Okay, great. And now you can include the ear we're not testing. And then we can do
Face mask. Stethoscope. Floor tile.
Very good. So that would be the hearing test. Now remember, we can do Weber, which is easy to remember. That's another test of hearing. It will lateralize to one side or the other. This is a gross test of hearing. How we test the Weber test. You whack it on your hand. You put it in the midline. Brittany, do you hear it more in one ear or in both the same?
Both the same.
That means that she has normal hearing in both sensory and neuro. Now we can do one more test, which is the Rhine or Rene, depending on where you are in the country. And this is where air conduction is greater than bone conduction. And so what I'm going to do is strike this. I'm going to place it on our mastoid process. And she's going to tell me when she stops hearing it. Air conduction should be 2 times that greater than bone conduction. So first I'm going to do bone conduction. When she stops hearing it, I'm going to pull it away. And then we're going to do air conduction. I want you guys to count 1, 2, 3. Okay? When I'm doing this, not out loud, just to yourselves, and we're going to compare air conduction versus bone conduction. Okay, ready, Brittany?
Mm-hmm. Okay, I don't hear it anymore.
Still hear it?
Mm-hmm. It's gone.
Okay, so you could see that air conduction was 2 times that of bone conduction. What numbers did you guys get? Did you not count? Huh?
It was 10 to 20.
10 to 20. So we're good there, right? So Brittany looks great. So we're good. We will assess the vessels. We'll assess the vessels with part of the cardiovascular assessment. Thank you.